Hello, welcome to this presentation and welcome to the teacher channel. It is good to have you here, and today's presentation will be on first aid multiple choice questions, and it is part of the self-evaluation series. And as you can see, it is quiz time, and it is Dr. Tim presenting, so you're welcome. Please indicate your answers on a sheet of paper. So you are expected to indicate your answers on a sheet of paper. Please take a sheet of paper and indicate your answers on that sheet of paper. At the end of this presentation, I will provide you the correct answer. So the correct answers will be provided, with which you can now evaluate yourself, grade yourself based on the correct answers to be provided. Please do this and let us go now. Question 1. It is not ethical to assume that a patient is potentially infectious. A, true. B, false. So what do you think about that statement? Is it a true statement? Is it a false statement? Question 2. A child patient is a person who A, is under 1 year old, B, is between 0 and 10 months old, C, is more than 1 year old but hasn't reached puberty, D, none of the above. A child patient is a person who. So write your answer on the sheet of paper, please. And then question 3. Question 3 now. Which of these are the right first aid for the shock emergency? A, give the patient a shock medication. B, give the patient something to eat. C, call 911 or emergency number. And D, cover the patient to maintain the temperature. E, C, and D. Make your choice, please, and then question 4 is on the way. Question 4. The following are the scene survey activities except A, scanning the area for safety hazards. B, assessing patient for any life-threatening conditions. C, taking necessary protection measures. D, obtaining permission or consent from the patient. So there is one option there that is not covered during scene survey. Which one is the one that is not correct? Write it on a sheet of paper, please, and let us go to question 5. Question 5. Someone stated that a heart attack and cardiac arrest are the same. What do you think? A, I agree with the person. B, I disagree with the person. C, it depends. What do you think about that statement? Please write it down on a sheet of paper as we go to question 6. The law that protects the first elders from liabilities is called A. Good first aid and CPR law, B. Excellent Samaritan law, C. Good Samaritan Constitution, D. Good Samaritan laws. Make your choice. Indicate it on a piece of paper that you have, and then question 7. One of the things to remember when performing CPR is, one of the things to remember when performing CPR is A. To push as hard and tough as you can. B. The rate of compression is 90 to 120 per minute. So the rate of compression is 90 to 120 per minute. C. Maintain 100 to 120 compression rate per minute. D. Allow the chest to recoil 100% between compressions. Which option is correct? Indicate it on your piece of paper, and let us go to question 8. Question 8. Someone stated that first aid should be provided in the position in which the patient was initially found. What do you think? What do you think about that statement? A. Yes, that is a true statement. B. No, that is a false statement. C. It depends. Question 9 is coming. I believe you will have indicated your choice on a piece of paper. Question 9 is here. Which of the following about RICE is wrong? Which of the following about RICE is wrong? A. Rest. B. Eyes. C. Code. D. Elevation. Which one is wrong in the acronym RICE? Please write your answer down as we go to question 10. Question 10. What positions can a patient be placed in during first aid? What positions can a patient be placed in during first aid? A. Supine position. B. Tripod position. C. Semi-sitting position. D. All the above. Question 11. Severe bleeding or severe blood loss can lead to A. Anaphylactic shock, B. Hypoglycemic shock, C. Hypovolemic shock, D. Electric shock. Make your choice. Write it on the sheet of paper that you have, please, and then let us go to question 12. Question 12. At what point is a patient assessed for non-life-threatening injuries? At what point is a patient assessed for non-life-threatening injuries? A. Secondary survey. B. Ongoing patient care. C. Scene survey. D, primary survey. Write your answer, please, and then question 13 is on the way. Question 13. Cycles of CPR should continue until a patient becomes exhausted. B, EMS arrives and takes over. C, first aider starts breathing normally. First aider starts breathing normally. D, all the above. Please like this video. If you have not, please like, pause, click the thumb up, the like button. Please like the video and get ready to move on. Please, if you have not liked the video, do so. Give me a like here, please. Very important. Thank you so much. Let's continue. Question 14. An environmental related emergency in which the patient's temperature rises dangerously is called A, heat stroke, B, hypothermia, C, heat cramp, D, heat exhaustion. Make your choice, write it down, and then get ready for question 15. Question 15. Given a sugary drink is a basic care measure for an unconscious hypoglycemic patient. What do you think about that statement? I agree. A says I agree. B, I disagree. C, it depends. Given a sugary drink is a basic care measure for an unconscious hypoglycemic patient. A, I agree. B, I disagree. C, it depends. Question 16 is coming. Question 16. The emergency scene management, ESM, include these steps except A, scene survey, B, scene tracking, C, primary survey, D, secondary survey. Okay, so get ready for question 17. Write your answer down for 16 and then 17. Question 17. Which of these is outside the scope of first aid? Which of these is outside the scope of first aid? A, checking the scene for safety. B, putting on gloves during wound care. C, medication administration. Medication administration. D, calling the EMS number. So which one is outside the scope of first aid? Checking the scene for safety, putting on gloves during wound care. C, medication administration. D, calling the EMS number. Which one is your choice? Write it down. Question 18 is coming. Question 18. What position should be recommended for a patient who is unconscious but breathing normally? A patient is unconscious but breathing normally. What position would you recommend for such a patient? Let's see the options. A, supine position. B, semi-sitting position. C, recovery position. And D, tripod position. Make your choice as we go to question 19. Question 19. The main purpose of an AED or defibrillator is. The main purpose of an AED, automated external defibrillator, is A, to prevent cardiac arrest, B, to prevent ischemic attack, C, to stop myocardial infarction, D, to restore normal heartbeats. Question 20. Which of these is a controllable risk factor for cardiovascular disease? A, age, B, stress, C, ethnicity, D, family history. What is your choice? As we get ready for question 21. Question 21. Which of these can cause medical shock? Which of these can cause medical shock? A, heart attack, B, severe blood loss, C, severe allergic reaction, D, all the above. Question 22 is about to be revealed. Get ready, write your answer down, and then question 22. The signs and symptoms of severe allergic reaction include A, diarrhea, B, breathing difficulties, C, respiratory or cardiac arrest, D, all the above. All right, I believe you have made your choice to question 22 and you are ready for question 23, and here it is. Question 23. Angina always leads to heart attack. Angina always leads to heart attack. A, true, B, false, C, maybe. Question 24. Mr. TT appears to be having stroke. What do you expect to see when assessing him? Mr. TT appears to be having stroke. What do you expect to see when assessing him? A, face drooping, B, arm weakness, C, speech difficulty, D, all the above. Question 25 is coming. Question 25. What is the appropriate first aid for Mr. TT, who has been confirmed to be experiencing a stroke? What is the appropriate first aid for Mr. TT, who has been confirmed to be experiencing a stroke? A, put him in tripod position. B, give him aspirin. C, call 911 immediately. D, spend a bit of time to assess him. What is your answer to question 25 and then question 26, which I believe the last question is about to be revealed. Here it is, question 26. Sample S-A-M-P-L-E, sample, is a guide for knowing the medical history of a patient. What do A and L stand for in the acronym sample? A, anemia and last meal. B, allergy and last time seeing a doctor. C, anti-allergy and last meal. D, allergies and last meal. Which option is correct? So want to see the correct answers. Remember, you should be able to grade yourself soon. Let's go for the answer keys. Answer keys, those are the correct from question 1 to 5, and then question 6 to 10. Those are the correct answers to each question. Then 11 to 15, those are the correct answers. Please match them with your own and get ready to grade yourself. And then 16 to 20, those are the correct choices, correct answers. And then 21, 22, 23, 24, 25, 26, those are the correct choices, correct answers to them. So count how many correct ones, correct questions you have. And then you can do over 26 and see if you want it in percentage, you can multiply by 100. So how many did you get correctly? How many? How many? Count how many correct. Please count from 1 to 26. How many did you score correctly? How many did you get right? And please, are you able to share your score in the comment section? This is very, very important. You can type something like, I scored 100%, I scored 85%, I scored 95%. And so do that, please. Thank you so much. That will encourage others to, it will motivate others as well. And that will be a very good thing to do. Thank you so much. Thank you so much. I believe you enjoyed it. Thank you for watching. Thank you so much for watching. Thank you for your time. I appreciate your valuable time. Please like if you have not. Comment. What's your general impression about this? Put some comment. Did you enjoy it? Did you like it? Did it help you? Please put it. Just one line of comment will be okay. And I want you to do that. Please, to help this channel. You are promoting this channel as well. Share it to people. Share it to people you are going to recommend for the training. And please, if you have not subscribed, why not do that? Just click the subscribe button and remember to turn your bell on so that when I upload video, you'll be one of the first people to get alerted, and then you can watch it. So thank you so much and see you next time. Bye bye for now.